are honored by one panelist member, Charlie Hungerford. He is the Director of Admissions, Southwest Baptist University, Springfield. So on behalf of the Navigate 2020 event sponsors, Go to College Fairs, I'd like to thank Charlie for taking the time to present today, and we can begin whenever you're ready, Charlie.
Thanks, Alex. It's good to be here. Again, my name is Charlie Hungerford, and I serve as the Director of Admissions at Southwest Baptist University Springfield campus, which is a community dedicated solely to educating students for future careers in nursing and radiography. In preparing for tonight's session, I surveyed and interviewed admissions staff people and instructors from a variety of health occupation training programs, just seeking their input and advice on how students can best prepare for the rigorous education programs found in healthcare settings. And so I want to spend some time just working through several areas tonight that will, I think, help us figure out exactly what path you should take and what kind of things you can start to do that will allow you to work your way while you're in high school through everything, and then make sure that you get off to a great start. So with, as we look at it, we're going to look at 4 areas or 4 themes that will really, that just kept showing up over and over during the comments from people when I was preparing for the presentation. When I was talking to people, these are the things that they really felt like were important for students to do. So one, when what you're going to do in high school. So you're going to start in high school, what kind of things can you do, and what you do, the choices you make in high school really can make a difference. They really do matter. We're going to talk about choosing the right school, things that you should consider when you're choosing a school to attend after you graduate from high school. What you can do during that first year to really start well once you get to college. And then once you're at the end of your program and going on for medical school or dental school or into a nursing training program, whatever it is that next step is for you, how you can end strong, and then how you can just be prepared to keep on going forward in the career path that you're choosing. So that's kind of a roadmap for what we're going to follow today and what we're going to do. So when we talk about starting in high school, there are some things that come up. So real quickly, develop good study skills, look for those interesting, practical, and various healthcare related experiences. We're going to talk about 4 years of science, math, and English, and then we're going to talk about researching areas of the highest interest and how you become familiar with them. And so just breaking these down just a little bit as you look at these things. First, what you want to do while you're in high school is really build these habits of good study skills. You want to get used to reading and studying before the class time begins, not just cramming right before it starts, but really getting the information locked in and part of what you know. So if you're going to be in healthcare, that science, that math, those skills you learn, it's not just being able to regurgitate the facts, but it's really having that as part of your knowledge base, because what you do builds on it. So every semester continues to build on the information that you got in the previous semester or this previous year. And so you want to be able to take that information and make good critical thinking decisions with it. You want to learn to make and keep scheduled study times every week so that you're actually on a path for success, and you know that you don't get surprised by a paper or an exam, something like that. So you want to keep up with that. You want to break that study schedule down into manageable sections, and that's going to be different for each one of us. So some people can handle an extended study break of or an extended study time of an hour or 2. Some people need to break that down into real manageable chunks and study for 30 minutes, take a 5-minute break, come back for 30 minutes, take a 5-minute break. So what works for you? But high school is a great time to practice those things and begin to figure out what is actually going to make a difference for you, what's going to help you be successful. And then we also want to look for alternative ways to study. So just memorizing facts off a sheet of paper is not necessarily the thing that works for everyone. So maybe reading and highlighting works for you. Maybe you need flashcards, maybe doing practice quizzes. There can be all different ways to prepare and to study. And so find those things that really make a difference for you and allow you to really get that information locked in. And then while you're doing that, determine your preferences and your learning styles. Do you study well alone? Is it more helpful for you to work with a study group where you're each teaching part of that content to each other in a practice environment? So find those ways to to build on those learning skills. And then obviously some things that you're probably already hearing, don't wait for the last minute to prepare for tests and projects, and study ahead where you can. So, because that makes a difference if you're reading ahead, or like when your instructors start to present on a topic, if you're already a little bit familiar with it, then you can ask those well-informed questions right then in the class, and that actually helps your learning. So those are all different things that you can do as you're looking to develop good study skills while you're in high school, and those skills are going to carry forward with you then. The next thing we want to do while we're in high school is start to look for interesting and a wide variety of healthcare related experiences. So that could be something as simple as just doing a job shadow. As you are probably aware, getting into a hospital now is extremely difficult, but there are some other things that you can do that are job shadowing. So maybe your local doctor or almost every family knows someone that's a nurse, so you can spend time with those folks. Go to your dentist. Maybe you could, where your family picks up the prescriptions, you could get to know the pharmacist there and spend a little bit of time behind the counter just learning about that job. But look for this wide variety of experiences so that you can see what healthcare, what it all entails. So if you're an athlete, go spend time with a trainer, go spend time with a physical therapist, and find out what that part of medicine is all about. So, but look for some variety so that you can get a good feel for healthcare and how it works together. If your school has a program like Medical Explorers, or check with your local hospitals and see if there's a Medical Explorers program that you can be a part of, or some other medical community for high school students where you can actually get in-hospital experience. That can be great. And don't forget to think about part-time jobs. So you can work at a hospital or a clinic while you're in high school and start to get that experience that would let you know for sure that you're comfortable at the patient bedside and you're comfortable working around people who are sick. An interesting quote, there was a radiography instructor, Tara Hathcock, that I talked to, and she said, when I started x-ray school, I didn't even have a basic understanding of what I would be experiencing. It was a culture shock. Spending a little time in the hospital or on a clinic site would have gone a long way towards showing me the actual job and not the layman's concept. And so these job shadowing and practice environments can be a really good opportunity for you to explore and make sure that this is exactly what you want to do, and it's going to lead you to the path that you have in mind for your career. Regarding your high school classes, I can't stress this enough, and it came through in almost every instructor that I talked to. Take as many math and science classes as you can fit into your schedule. If you're going on in for healthcare, that strong background in math and science is going to be critical for you moving forwards and feeling successful when you move forward. If your school offers a college preparatory program that you can be part of, take those challenging classes too, and make sure that you're getting 4 years of science, math, and English. You want to wrap all of that into that college prep program. And then interestingly, almost everyone I talked to also talked about this really strong foundation of communication skills. A nursing instructor, Dr. Sylvia Barber, that I talked to, she said, of course, science and health science classes, but I think they should have a good foundation of English as well, to help with writing skills as they further their careers in education. And then another instructor that I talked to, Dr. Thomas Elwood, who's the executive director of the Association of Schools of Allied Health Professionals, said, demanding on the health profession, different levels of education and training are required, but they have one feature in common. They need high school graduates to enroll in academic programs who are well prepared in science, mathematics, and English, in addition to having computer skills. So you see this, both of these instructors talked about this really well-rounded base. So it's not just science and math, although you need that, and you need a really solid foundation in that. But you need to be well-versed in other areas like English and good communication skills, and even computer skills are going to really pay off down the road for you as you move through healthcare careers and healthcare research. And then the final thing you can do in high school is start to research those areas that are of interest to you, and then become really familiar with them. So don't forget to visit medical facilities, nursing facilities, healthcare schools while you're in high school. So it's not too early to start taking a look at nursing schools, or to go visit a medical school while you're on a summer break or something. So they should appreciate the fact that you're already exploring and trying to figure out what it is that you want to do. So during that junior, senior of high school, start exploring those programs. Certainly while you're doing your college visits, add some other programs that you might be interested in to those visits. Researching a variety of programs can be really helpful too. So you can find out like what the intensity of the program is like, what's the transition to the program, and don't be afraid to ask questions. So when you're visiting colleges, when you're visiting nursing schools, visiting medical schools, or whatever kind of healthcare program you're interested in, don't be afraid to ask questions, and make a point to talk to people like me who are on the admissions staff at the school or who recruit for that school. If you get a chance, talk to the instructors. What makes a good student in their program? What makes a good fit for their students? As their students come in, what kind of things make them strong students, and what make those students make a really good adjustment to the program. All those kind of things are great questions to ask instructors. And then if you get the chance, talk to a student or two. What did they think about the transition? What do they wish they, what would they tell themselves coming in that would have maybe made the transition easier? So talk to a student or two. You can do that at your colleges that you visit, and certainly do it again at the preparatory schools that you get to in terms of healthcare professions. So make sure you talk to those folks. And then if you can, while you're in high school, gain just a basic understanding of medical terminology. So if you're working in a hospital or clinic, you're going to have the chance to pick some of those things up, but just start to get familiar with some of those things. It's number one, it'll be one less thing for you to memorize when you get into that healthcare program. When you get into those classes, the terms in the books and in the lectures are already going to be familiar to you. And it's also going to just make that easier transition to those healthcare classes that you have to take. So if you just have that basic understanding of medical terminology, it'll make a huge difference. So those are the things that you can do in high school. You can develop good study skills. And what does that mean for you? You can look for some experiences that will get you down the road. You can do that research in those areas then that you are most interested in, and then make sure that you're looking at your schedule and taking the kind of math, science, and English classes that are going to make a difference for you. So when it comes to achieving your healthcare goals, then it's important to choose a college or a university or a training program that's going to provide the right opportunities for you to do exactly what you want to do. So in choosing the school or the program that you're going to attend, you want to do at least these 4 things. So you want to research the program and the requirements at each school, because it's different. So the entrance requirements may be different at one medical school than they are at a different medical school. Or like here where I live, we have 4 nursing training programs here in our city, and each one of us has different requirements. We share a pretty common set of prerequisites, but all 4 of us have some different nuances for those things, different GPA requirements, different classes that have to be done before you start the program. So you're just going to know what that program requires at each school that you're considering. And you definitely want to consider more than one school. You want to know the statistics about that school, and we'll talk about that in a second and what that actually means. You want to make sure that you're considering the entire cost, not just tuition and fees, and then you want to consider the entire time that it's going to be necessary to get through the program, not just the semesters, but like what's the entire program look like if you have to take prerequisites. Some of this is really important, especially when you're choosing the right school, because it's important to remember that like to become a nurse, you actually just have to pass the nursing licensing exam. That's the requirement to go from not being a nurse to being a registered nurse. But you can't be invited to take that test to become a nurse unless you graduate from an accredited school of nursing. So not just everybody can take that test, you actually have to graduate from a program in order to do that. And so you want to make sure that the school that you're going to go to is going to let you do what you want to do. So when you're looking then at these programs, when you're talking about like program requirements at the school, so what specific coursework is required to enter their program? Do you have to have, like if you want to go to medical school, do you have to have organic chemistry? The answer is probably yes for that, but you'll want to check with every school and make sure that you're getting the coursework that you need. You need to find out, will the dual credit, dual enrollment, advanced placement, international baccalaureate high school coursework that you might be doing, is that going to transfer into that medical school? A college that I used to work at, we would always caution students if they knew they were going to go to medical school, to not take like chemistry and anatomy and physiology for college credit at their school. Go ahead and take the classes, but not take it for college credit. And it wasn't that the college I worked at wouldn't accept it, but the medical schools that we sent our students to oftentimes wouldn't accept that chemistry class as a required class because it had to be done on a college campus. And so you just want to know those kinds of things about the coursework that you're taking. Definitely take the rigorous classes. You'll find them helpful. It'll be meaningful for you. But just make sure that before you pay for the credit for the class, that it's actually going to work for you in the program that you want to go to. You want to understand the education path. So what does it take to actually become a doctor? What does it take to become a nurse? What does it take to become a physical therapist? You want to make sure that you understand that entire education path. And then talk to the school. Are there going to be good clinical or internship or practicum opportunities available? Are you responsible for finding them yourself, or does the school help you find them, or does the school assign you to them? So those are going to be differences in programs that you look at. And so you want to make sure that you have a good understanding. And that's one of those things you can lay side by side and compare the school in terms of ease of transition. So if the school assigns you to an internship or practicum, that's easier than you having to find one on your own. But if you want to go around the world and look at a bunch of different internships when you're getting close to that graduation spot, then you may want to get a program where you find your own. So it needs to balance what you want to do versus what the school does. And then you want to make sure that you check out a school's accreditation. I talk to people all the time who are taking classes at schools that aren't accredited, and then they come into our program only to have to start over instead of getting to take the credits that they've already earned because they're in a non-accredited school. So just have an honest conversation with the person you're working with at that college or school to make sure that the program's accredited. And then when you get done with that program, like nursing schools, like I mentioned, you have to come out of an accredited nursing program in order to get invited to take the licensing exam. So you could study to be a nurse, but if your school's not accredited, then you never actually get to become a nurse. So then when you're comparing schools, one of the things that you really want to do is make sure you have a basic understanding of each school's institutional statistics. And every school that you're talking to and every school that you're considering should be able to provide at least this base set of school statistics. So how big is their applicant pool? So how many applications do they get versus the number of spots that they have? So for a good example, the nursing school that I work at, we take 90 students every semester. So 180 students a year, but I can't take 120 in the fall semester and just add 60 in the spring. We're limited to 90 students every semester. And so we may get 160 or 170 applications for those 90 spots. And so not everybody gets in. And so you just need to know what the size of their applicant pool is versus the number of students that they accept. And so what is their anticipated acceptance rate? Then what's their failure rate? How many students are not successful in their program by semester or by year, depending on the program you look at? So how many students start it but don't progress into the next semester? And then what's their persistence to graduation rate? So of the students who start, how many actually finish that program and get to move on? And once they graduate, how many students are successful on the licensing exam? And we all have to report this information every year to our licensing agencies, and so our accrediting bodies. And so the school's going to know that information. And then finally, how successful are their students? What percentage of their students go right into the careers and jobs that they wanted? So this is basic information. Every school should be able to provide that for you. And then when you're looking at programs, once you've researched it and you can say, these are the 4 schools I'm looking at, here's the information about the school so I can compare things. I can do apples to apples comparison on everything about the schools. Then you want to look at the cost. And again, this is dependent on your family and what you all can do and what you can afford, or what you want to take into account in terms of cost. But so everybody talks about the tuition, how much does it cost to go to the school, but you also want to factor into this, what are the fees that you have to pay? So do you have to buy your own stethoscope? Do you have to buy a lab coat? Do you have to buy scrubs? Do you have to buy medical supplies for your simulation coursework? All those kinds of things are things to consider. How much is it going to cost to live in the city at the school that you choose? So Obviously, big city living is going to be more expensive than perhaps suburban or rural living. So where that school is going to factor into how much it costs to live there. And then what other expenses might there be besides living expenses? Does the school offer on-campus housing? Are you going to have to find an apartment and pay deposits and utilities, all those kind of things? And then are you going to have to get yourself back and forth from your school or where you're living to like a hospital for your clinical experiences? So if you are in a school program that is actually based in a hospital, maybe everything's right there. But like the school I work at is about 3.5 miles from the closest hospital that we work with for our clinical experiences. So our students have to find their way back and forth. They carpool and ride share and everything. But if you don't have a vehicle, then how are you going to get to that clinical experience? So just some things that you have to consider about navigating that whole picture of what the entire cost is, not just the tuition and fees. And then the final thing here when you're choosing the schools is how long does it actually take to complete the program? So you want to know what the total length of the program is. So not just the coursework, but coursework plus any internships or practicums or anything like that that is added on to the end of the program. So you want to know what that whole picture is. Can you double up on coursework? Can you take things at a different pace? So if you want to slow it down, can you go part-time, or is it a set curriculum? Can you take stuff in the summer that would get you through the program faster? Or maybe you want the summers off. And so if you go to a program like our X-ray program at the school where I work, then it's a year-round program. And so you don't get to take the summers off. So if having a summer off is important to you, then you want to find a program where the summer was not a requirement. And also, is it possible to sit out for a semester if you need a break in the middle of it, if you have some kind of crisis in your family or an emergency or something like that where you needed to sit out a semester? Is that possible, or are you going to have to go back to square one and start over if you do that? So, and then would you be able to establish a support system in the community that you're at? So everybody will tell you that any kind of medical training program, they're difficult. And so if you're living in a city completely by yourself, are you going to be able to get that support system that you need if things go sideways for you and you end up struggling or having some issues where you need some support that could be family oriented or friend based oriented? So just make sure that those are things that you consider when you're looking at the time that you need to complete a program. So now that you've finished high school and you've made a really difficult choice about where to go and what to do next and where you want to end up, the next thing that you want to do is look at that first year of college. And so what you want to do is really start well. So we're going to talk about 4 things here. What does it mean to start well? So your academic performance during the first year is critical. We'll break that down. We're going to talk about what those relationships with professors can do for you. We're going to talk about the student organizations that you can join, how you want to choose those. And then we're going to talk about picking your major in the coursework, because you're going to set the path that first year with your ultimate goal in mind. So when we talk about your academic performance, I just can't stress this enough. Grades are always important. And so you're probably hearing that in high school already, that GPA is really important. That's going to be crucial during your first year of college, because it's really going to set the tone for how the rest of that goes and whether or not you're going to be able to have the GPAs that you need to move forward, or if you're going to have to repeat some classes in order to do the thing that you want to do. So, and honestly, grades are the best indication of a student's capacity to excel in advanced coursework. Then you want to follow the suggested plan of study. So like with our students, we have a path that we like for them to follow. They don't have to, and we get students who have done their coursework in an unusual progression. But if you follow the suggested plan of study, it's easy for someone on the admission side to check all the boxes that we need to check to make sure you've done all the coursework. And the coursework is usually designed sequentially, and so it's going to be easier for you to build on the coursework as you take chemistry and then you take microbiology. Those things are going to build on each other, as opposed to just kind of having a random haphazard approach to just checking off all the classes that you need. And then take the courses in proper progression too. I always think it looks odd when I see a student who took an advanced class before they took the basic class. And so, not that they couldn't be admitted, but it's just one of those things where it makes me stop and pause for a minute and make sure that they've taken everything. And so, if you take those courses in proper progression, they tend to make more sense and they tend to build on each other. And then you need to know what the prerequisite coursework is going to be required for the field you want to go into. Then you want to excel in those classes as much as you can. Remember that the more science you can take, the better off you're going to be. So make sure you get that solid foundation in science. Remember that GPA always matters. And then this final thing, we talked about this a little bit with the high school part, but in college too, communications classes make a huge difference. So one of the instructors I talked to, Tara Kuther, said that school admission committees look for applicants who have the potential to successfully complete the program. Applicants must demonstrate the capacity to do the academic work entailed in earning a medical degree. This means that you must show that you have the capacity to handle all of the math and science required. And this is the most important thing I think that she said here. Your undergraduate coursework is the only indicator of your preparation and your potential for academic success. And I believe this so strongly after 20 years of doing college admission work, that previous academic success is the only and really the best indicator of future academic success. And so those are the things that we look at when we're reviewing applications and transcripts. We want to see that you have done well, or if you had a rough start, and some of us do, if you have a rough start, that we see growth and progression as you matured and as you got things figured out. So, but make sure that you're paying attention to that GPA, because it really does make a difference, and it can take a long time to overcome if you have a stumble along the way. So during that first year, you can also start beginning to build really strong relationships with the instructors and professors whose classes you're going to have down the road. And so these relationships and these that you can build with professors, they can lead to really strong letters of recommendation, because they're not just writing about a student, but they're writing about a student that they know, that they've worked with, that they've had in class. Maybe you worked in the lab too, and they really got to know you. It's going to give you more opportunities for research. And so if the instructor is doing some research, if they know you and know your integrity, they may ask you to participate. You could even get published while you're in college. And so those things make a difference when selection committees are trying to narrow down candidates. And then it leads toward better mentoring and advising too. If the instructor knows you and is invested in your life, they're gonna look for ways to make sure that you're successful as well. So make sure as you begin to start, you don't have to build a relationship with every professor, but pick one or two that you feel like you could get along with, that you have some camaraderie with, and then start to build those relationships with them. You're also going to have the chance to join student organizations depending on what your school offers. So choose some of these organizations purposefully and carefully, but also make sure that you look at some outside interests or extracurricular activities too. You want to be able to have some fun and build some social relationships as well as professional relationships. And so when you're part of those student groups though, they can provide professional connections and networking opportunities. Those are important down the road. They can build a stronger resume for you. So maybe you have a chance to develop some leadership opportunities in that organization. You maybe become an officer with that organization or lead a committee or something like that. So it shows that leadership potential and that you're able to balance and manage your curriculum and your rigorous study along with leading a group or something. And then it's also may lead down the road to enhanced academic opportunities. Maybe you can participate in some kind of national presentation or something like that that's going to give you some skills and some opportunities that not everybody has. So those all come out of student organization membership and participation. And then the final thing in this getting off to a great start in college is make sure that you're selecting your major and your classes carefully. So you want to work closely with whoever your academic advisor is at the school that you attend to make sure you stay on track towards your goals. We talked a few minutes ago about following those classes in the right progression. An advisor can really help you with that. So, and a great example here is like, you don't have to be a pre-med major to go to medical school, but you're going to have to take specific classes to get that, to get into a medical school. So a pre-med major may allow you to do that easier, but you don't have to. So if you're really interested in literature or history or something like that, you can get that history degree and still go to medical school, but you just have to balance all of those elective classes that you can take against what you need to do to get into medical school. So I found an interesting quote on about.com. It says, "The more science, the better. Students who choose majors outside the sciences will likely use all of their electives on science or may find themselves delaying graduation in order to complete the science requirements. A pre-med or science major is not necessary to apply to medical school, but it makes it easier to complete the science required by all medical schools. And so you have that right there. It's just, you can do what you want to do in college in terms of your major, but just weigh what you have to do to get into the next thing you want to do. Remember that most medical programs, especially nursing and x-ray, I know these well since I work with them every day, but we have specific lists of prerequisite classes you have to have in place before you actually start the program. And we do monitor that and check that on every student before they start. And then remember, other coursework is recommended: math, communications, English, those kinds of things are also recommended. I found another quote on educationportal.com. It says, "Nurse practitioners must possess excellent writing and speaking skills. Being able to concisely explain a procedure to patients and families is extremely important." And oftentimes what we don't remember or don't realize is that nurses are the ones who actually provide a lot of that information to families and students. And so the ability to communicate effectively, both in writing and verbally to a family is crucial. All right, so we've talked about these different areas about choosing the right school, starting well, what you can do in high school. And so the last thing we want to talk about today before we do some questions and answers here at the end is really, how do you end well? So you're through 2 years or 4 years of college, depending on what you're doing and where you're going to go. What are some things that really will help you end well? And then as you look toward finishing your degree, you want to keep these things in mind. Once again, grade point average is always important. You want to pay attention to the application and other paperwork deadlines. You want to develop a strong application for your program. You want to work on your interview skills. And you want to remember that your ultimate acceptance is based on successful completion of your current coursework or degree. So let's talk about these real quickly. So GPA, we stress that, but like most programs will have benchmarks you have to meet. And so with GPA, if you're at a 2.69 and the score requires 2.7, they're not going to round, they're not going to give any grace. And so those are lines that they draw in the sand, and they just say, this is the bare minimum we will accept. Anybody that's below it, we're just going to say no to automatically. And so just keep that in mind, that GPA is important, and know what those schools are going to require. And they'll be able to tell you what their minimum requirements are. So pay attention to deadlines. So like with the programs I work with, the deadline is 6 months before the program starts. And if your application comes in after that, it doesn't mean that I can't work with you, but you're not going to be a priority for me. And so you want to make sure that you're doing everything that you can on your side so that your application is going to be reviewed. And so part of developing a strong application is making sure that all your paperwork is turned in on time or before time. So keep those deadlines in mind and make sure that you hit them all. You want to work on interview skills. If your school is going to require an interview, make sure you work on those skills. Have somebody practice with you several times. And don't just ask those questions that you think are going to be like, why would you be a good fit for us? Why do you want to be a doctor? Why do you want to be a nurse? Things like that. But have them ask you some random questions, because an interview committee may throw just a really random question at you to get to know you better or to help you relax. So they may ask you, like, if I turned on the radio in your car, what music would be playing? Or, you know, the last time you went to a sports event, what food did you eat? So something like that can be really interesting because it helps them get to know you as a person. And it also kind of breaks the ice and makes the interview situation a little more comfortable. So practice the whole thing, but definitely think about what strengths you bring to their school, why you want to be a doctor, a nurse, an x-ray tech, whatever it is, so that when you're interviewing, you already have something in mind for that. And then remember, this is the most, probably the most important thing about ending well, is that your ultimate acceptance in whatever school that you're going to go to for your medical training is dependent on your successful completion of your current coursework or degree. Every semester I work with incoming students who are going to be in our nursing program who got admitted to the program and they just let their guard down in like microbiology or physiology or something like that. And they ended up making a C or a D in that class, and then they don't get to start our program. So they have to go back and spend another semester, another year fixing that GPA before they can reapply to the program. So just remember that as you finish up your college career as you're moving into medical school, or if you're finishing up your prerequisites, moving into nursing school, something like that, that you have to complete those classes that you're in right now, and there has to be a successful completion. So I always hate to have to pull people from our program. I do it every semester, and it's never an enjoyable or fun conversation to have, but it's something that every school will do. So before we wrap things up, I want to look at a few questions that you should ask yourself if you're considering if healthcare might actually be the right path or the right career field for you. And then we'll get to your questions and answers here in just a second. So ask yourself these questions though. Do you like to work with people? Do you like to work closely with people, day by day, hour by hour, minute by minute? Because everything in healthcare means working with people all the time. So good healthcare is always related to someone else. The second question, are you comfortable with science? At the end of the day, most healthcare education and careers come down to a solid foundational knowledge of science and math. To enjoy healthcare education and a career, you have to enjoy science too. Are you prepared for a lifetime of learning? In healthcare, there's always new technology, always new treatment regimens, always new diagnosis things to come up with and to keep up with, new machinery, new equipment to use. And so medicine is constantly changing, updating, modifying, and creating new things. And so people who enter healthcare careers are destined for lifelong learning. And so it's just going to be part of something that you have to go through, and you actually have to continue to meet those educational requirements. So it'll be required education hours that you have to complete while you're working as a nurse or a doctor or an X-ray tech, something like that. There's always going to be education for you to do. Are you comfortable in a healthcare setting? That's a great question to ask. If it makes you really nervous to go to the doctor's office or your dentist's office or to go visit someone in the hospital, this may not be the right path for you. And so just keep that in mind to answer that question. And if you are nervous about that, you can get over that by spending more time. So get a job at a hospital, or spend a lot of time job shadowing till you get a level of comfort, because you're going to be there a lot. And so you want to make sure you're comfortable there. So are you a team player is another great question to ask. So medicine doesn't happen in a silo. So healthcare workers are always part of teams. So the doctors work with nurses, they work with therapists, they work with clinicians, they work with technologists, and so they all work together for patient care. And so no matter what you do in healthcare, you're going to be part of a team. And so you have to be willing to be part of a team player. And then a final question that's really, I think, important to ask is, what kind of lifestyle do you envision for yourself? And so healthcare careers can be flexible and they can provide really good income, but there are also demands on your time and your schedule, especially coming right out of school. Just remember that a lot of healthcare workers, they work evenings, they work nights, they work holidays, they work weekends, they might have irregular hours, they might have really long shifts. These are all things you have to consider as you move in. And so they don't always work like 3 12-hour days in a row and then have 4 days off. They might work 3 days a week, but it might be Monday, Wednesday, and Friday. And so if you're working overnight, it's really hard to have a normal routine with that, where you're sleeping part of the day and then the next night you're off, and then you're sleeping part of the day and then the next night you're off. So keep that in mind, that while it's a flexible schedule and you can eventually work your way into a more permanent schedule, you may have several years of irregular schedules. And if that's not a good fit for you, then that's going to be a tough thing. So those questions: do you like to work with people? Are you comfortable with science? Are you prepared for a lifetime of learning? Are you comfortable in a healthcare setting? Are you a team player, and what lifestyle do you envision? Those are all questions that you can ask yourself and help you determine if it's the right, really the right fit for you. So, like I said, I've been doing this kind of work for a really long time. These are some frequently asked questions that I get over and over when I'm talking with students about healthcare careers. So I want to address these 3 questions, and then we'll get to any questions that you've asked here and as soon as we're done here. So if I'm interested in healthcare, are there some good AP or dual credit classes that I can take while I'm in high school? You'll want to check with your schools that you're looking at first, but some of the best ones I've seen that transfer well are what I think of as those basic first-year college classes, things like English composition, psychology, US history, basic computer applications, college algebra. A lot of those are going to be like first-year college classes that you do, and they can transfer in really well to most schools. And there's going to be some other options maybe that your school offers as well, but you want to make sure that the classes that you're taking will transfer for credit before you pay for that class. Go ahead and take the rigorous class, but only pay for the credit if it's going to serve you down the road. So the second question I get a lot is, how long will it take me to earn my degree and become licensed? And again, this is going to depend on the kind of degree or certification or license that you're seeking. Some of the more direct patient care programs like nursing, x-ray technology, and other imaging technology, respiratory therapists, surgical aides and surgical technologists, those can be completed in 2 to 3 years a lot of times, and you can start working pretty quickly in your chosen field after high school graduation. You can be a registered nurse in 3 years after high school graduation. So it's a pretty short path to that healthcare career. But if you're looking at a more advanced program like a pharmacist or a physical therapist or a physician, then you're looking at a minimum of 7 to 8 years of education before you become licensed. And then especially like with becoming a doctor or a physician, you've got an additional 2 to 3 to 5 years of specialization before you're fully independent and working like as a surgeon or as a radiologist or something like that. You've got a lot of specialization work that you have to do. So just keep that in mind, that high school graduation to what you want to do can be as short as 2 to 3 years or as long as 10 years. So there's some things there to consider. And then I get this question a lot, what is the average salary that I can expect? And so I looked up a few. So I know nursing and x-ray because of the kind of students and programs that I work with. So an average nurse in the United States right now, the average salary is $62,000 a year. That's going to be varied depending on where you live and work, but the kind of the low end hourly wage for a nurse is about $23, $24 an hour, and the upper end for a registered nurse right now is around $41 an hour. So depending on where you live, where you work, and how much experience you have, but the average here in the US is $62,000 a year. For x-ray techs, it's right around $50,000 a year. Here in the United States. A pharmacist can make about $114,000 a year. That's their average salary across the board. And then physical therapists, $71,000 is the average salary. Becoming a doctor, it's a little more difficult to nail down an average salary for them. A family practitioner doctor is going to make a lot less than a really high-end like neurosurgeon or something like that that's highly specialized in a particular kind of care. And so it's certainly in the 6 figures, but it can be a lot more depending on where you live and what you work and what your specialization is. So, all right, well, those are the basic questions I have. Alex, I'm going to come back to you, and let's talk about some of the questions that folks have.
Awesome. Charlie, thank you so much for your presentation. I'm sure that everyone in the audience is giving you a big virtual round of applause. You did an excellent job. Yeah, like you said, let's just jump into some questions here. Now, this question's regarding COVID-19 specifically, and they're just asking, how will COVID-19 affect nursing clinicals and practicals at the university setting?
Okay, and that's something that we're actually working with the hospital and clinics that we work with right now. So we are actually this semester we had to suspend our in-person clinicals. I'm fortunate. I work at a school that has a really a high-end state-of-the-art simulation center and learning resource center. So if we're not able to go back into the hospitals by late summer or early fall, we can manage almost all of the inpatient care practice that we do in our simulation center. So we have digital mannequins that breathe and have heartbeats and pulse, and we have a child mannequin that can have a seizure. So we can practice a lot of those kind of things. We have a female mannequin that actually can deliver an actual baby mannequin, and that baby mannequin actually has a heartbeat and those kind of things too. So we can provide a lot of that practice care in our simulation center. So you want to look for a school maybe that has those options, but that's actually a great question. It's something that we don't know the solid answer to yet, is because it'll depend on where the hospitals are with opening back up. Like I live in Southwest Missouri, and where we are right now, the only people that can go into the hospital are the patients themselves. So family members can't come in or anything like that. So certainly student workers can't come in, but we will follow whatever the hospital protocols are once our students go back and are able to go back in. But again, I'm fortunate I work in a school with a really high-end simulation center. So we're able to do most of that stuff on mannequins and in our simulation center if we can't get back to the hospital.
Excellent. Thank you, Charlie, for that response. Just moving along here, a lot of people have questions about the healthcare career in general. Someone specifically asked, how/where do you find information on majors that best fit you, that are connected to your preferred healthcare career? So
Okay.
yeah, I think, oh, go ahead.
So yeah, so there are, I mean, obviously, I would start with your high school counselor, or if you have like a college and career counselor at your school, yeah, definitely work with them. Over the summer though, if you want to do some research, honestly, if you just start looking at like area colleges, maybe start it close to your home and just look at their training program. So if you just like, like if you just Google like nursing schools in Missouri, you're going to get the list of about 60 schools, and you can start drilling down on those and just seeing like what do they require. And then like we publish, and we're required to publish like through the State Board of Nursing here in Missouri. You can find out statistics about every nursing school. You can do the same thing with x-ray programs. You can do the same thing with physical therapy schools. You can start just looking at whatever their licensing agency is. And if you don't know that, again, a Google search will tell you that. So if you want to look at like nursing school statistics, if you just look for the State Board of Nursing, or just go to Google and say like, who manages nursing programs in Missouri, you're going to get that list or that link to the state board. And then on their page, then you can see details about schools. So you'd see the same thing. There's a licensing agencies in every state for every profession. And so, or there's a national accrediting body. So like for x-ray techs, they're nationally accredited. And so, but again, a quick Google search and that would tell you what that is. So, so you can start to, at this point, since we're all homebound for the most part, your computer can be your best friend in finding out that information. And then once you get that information, then look for those schools that are nearby. And that'd be a great, once schools can actually have students and visitors back on campus, summer's a great time to visit those. We don't tend to be as busy in the summer in terms of the applications that we're processing, and we're not going out visiting in the summer in terms of visiting high schools and college fairs and stuff. And so it's a great time to visit a training program, nursing school, med school, something like that, and just start to get a feel for what that's like.
All right, thank you, Charlie. Moving right along here, and you had mentioned something a little bit earlier in your presentation regarding this question here is it necessary or needed to go to a four-year college before med school?
In my experience, the answer is yes. It would be hard to get into medical school without a four-year degree. Typically, you see those students get biology or chemistry degrees, but again, that's not required. So, but you'll want to work with that. The exception to that would be like here in Missouri, and there are other states that have programs like this. So at the University of Missouri in Kansas City, they have a 6-year med school program. You come out of high school and you go right into medical school. It's, as you might suspect, highly selective and highly rigorous, and has a pretty high failure rate. Not most of the students who get in are pretty successful, but the number of students who don't get in is pretty high. So that's what I meant by that, is they have a pretty high or pretty low acceptance rate of the students who want into that. So you can go and you don't get if my understanding, I've never worked for them, but my understanding is you don't really get a bachelor's degree. Like your first degree is MD. Then you go to a school like mine. So I work at Southwest Baptist University. We have a pre-med program. Our students would get like a chemistry degree out of that pre-med program, and then they would apply to and go on to a medical school. And a lot of us, like a private four-year schools, and even a lot of the public four-year schools, will have official agreements with schools that have medical training programs like med schools. And so, the schools will maybe even set aside a certain number of seats for students from XYZ university to come into their medical school. So, but most students going into medical school who want to be physicians are going to have a four-year degree, and then they're going to go on to medical school right after that. So, or maybe sometimes take a year off and work on some prerequisite or increase their science base, and then go on to medical school.
And just kind of piggy off that question here, someone was looking for advice on what are some health-related careers that are in very high demand that only require a bachelor's degree. So maybe they're not interested in going to medical school, but they still want to work in the healthcare field.
Okay, sure. So direct patient care things are still really high. So nursing, you can obviously get into a great job with a 4-year or even a 3-year degree in nursing school. So an Associate of Science in Nursing or a Bachelor of Science in Nursing, either one of those degrees will get you into the nursing career. So that's going to be a 4-year degree. X-ray technology, anything that requires like a certification or is some kind of a technologist is going to be typically a 4-year or less than 4-year degree. So like surgery techs, respiratory therapists, all those things are still either 2 to 4-year degrees that you can do. And then if you're not really interested in patient care, but you want to work in healthcare, there are degrees like Bachelor of Science in Health Sciences, where maybe you could be like a clinic administrator, or you can work on the business or human resources side of a hospital, or the benefits side, or something like that. You can be involved in healthcare, but you're not doing patient care. And certainly a bachelor's degree. A lot of schools are doing like a Bachelor of Business Administration with a healthcare emphasis. And so you can get those kinds of degrees that would put you into healthcare, but wouldn't put you in direct patient care. But certainly some of the entry-level jobs too. So I mean, you can go right out of high school and become like a medical assistant, a certified nurse's assistant, something like that, and then work your way up while you're working in healthcare. You can go, work that job and go to nursing school or X-ray school or something like that at the same time. So there's everything from those basic, and then keep in mind that hospitals hire more than nurses and doctors.
Mm-hmm.
If you can think of a career path, it probably exists in the hospital. So they have IT support, they have food service, they have human resources, they have insurance folks, they have billing and coding people, they have groundskeepers, they have sanitation workers. So about any career path you could think of probably exists in a hospital community.
Absolutely. Thank you, Charlie. And moving on to nursing questions specifically, and I've got a number of questions about nursing.
Okay.
I think that this one really covers a lot of the questions. Do most nursing schools have an interview process for admissions in addition to a university admissions application?
I don't think, the ones that I've worked with, I would say it's probably 50-50. So more of us are going to just a strict look at the application and does the student meet the requirements. A lot of the schools that I've talked to in terms of, I have friends who work at other nursing schools, we talk about the selection process, what we do. A lot of us use a point system. And so you get points based on, and that's why I say things like GPA always matters. The stronger your grades are in those prerequisite sciences, the stronger your overall GPA is, how well you perform on admission testing. Those kind of things generate points for you. And honestly, we do a point sheet on every student, and we stack the point sheets in order, and we take off the top 90. And so, but if you get into some of your really highly selected programs, there's a program here in my city that only takes 80 students a year, and they get about 600 applicants. And I think they do some interview of when I think they make a cut, and I think they interview and select out of that. So, but that's the only of the 4 nursing programs here where I live, that's the only one that does interviews that I'm aware of. So I think it kind of depends on the school to school, but probably about half do interviews. So.
All right, sounds good. Thank you, Charlie. And we have enough time for about one more question here. So this one's regarding high school students who are looking to get into the healthcare field. And this one person in particular asked, what are the best places to volunteer in high school to start towards a healthcare career?
Okay, all right. Probably, I would say, based on my experience here, probably the best place to volunteer right now would be at a nursing home or a rehab facility where we have people who are in all stages of illness or disease process, or maybe in rehabilitation. You're talking about these inpatient places where people go and stay for a long time. So hospital volunteer work, it's just difficult right now with the COVID-19, and hospitals have been locking down more and more of that over the past few years anyway, unless you're in like a medical explorers program or something like that. But if you just want to volunteer for healthcare experience, a few places you could look. So look around at a nursing home. They almost always have the need for people just to come in and and be friendly to some of their residents and things like that. So you can definitely start to get some experience around healthcare, and you're going to see a wide variety of patient needs and illnesses and disease processes in nursing homes. And so it's a great place, and they need the help too. So in terms of just because the people are there all the time, and a lot of folks don't have family that visits them very often. And so a good volunteer is a welcome relief at a rehab center or at a nursing home. And then if you live in a community with like a veterans medical center, those places are great. Are still welcoming of volunteers as well, and so you could do that. And then if you have a community health center in your neighborhood or in nearby where you live, you might check with them. And then some of these like community service organizations, like pregnancy care centers or like developmental centers for children with developmental delays or disabilities. Those are also good places that take volunteers, and it starts to get you around healthcare features and some interesting disease processes too.
Awesome. All right, that concludes this expert presentation about education and careers in healthcare. Remember, this is available online to rewatch. It will be available starting tomorrow at the Navigate 2020 event page. So you can go back and rewatch Charlie's presentation. Charlie, you did an excellent job. Thank you so much for taking the time of jumping on. And like I said earlier, I'm sure that everyone in the audience is giving you a big round of applause if you could hear it. Just a couple of, just one last minute thing, everybody. You can explore your college options in our virtual college fair. We have hundreds of interactive virtual booths where you can watch videos, download material, and even chat live with admissions representatives. You can also find some live streams are being run by booths themselves as well. So you can go ahead and visit that if you have an opportunity. Once again, that does conclude our time today. Charlie, you were wonderful, and thank you so much again for jumping on. Have a nice day.
All right.